All right. So again, my name is Carly King. I'm here on behalf of Net Community Care, KUA number 7, and also a representative from the Kinship Care Planning Committee as well. And I am very honored to be filling in for Lady B today, who unfortunately will not be with us as the MC and the moderator. So first up, I would like to introduce our first presenter. Mr. Gary Williams is a member of Philadelphia DHS. He resides in Philadelphia, Pennsylvania, and has worked in child welfare for more than 20 years. He earned his Bachelor's of Science in Criminal Justice at Lincoln University and a Master of Science in Social Work at Temple University. He currently is working on a doctoral degree in Marriage and Family Therapy at Eastern University. Mr. Williams is the Deputy Commissioner for the Children and Youth Division at the Philadelphia Department of Human Services. He has been with DHS for 19 years and has provided leadership in various capacities such as the hotline, general intake, sex abuse investigations, family preservation and reunification services, and crossover youth practice implementation. That's a lot. He is a former trainer for the Pennsylvania Child Welfare Training Program and has trained the safety assessment practice model across the state. Mr. Williams also has served as a project manager for Philadelphia's Reform Initiative in 2007, where DHS adopted the nationally recognized safety assessment practice model and developed a hotline-guided decision-making system. He continues to provide leadership to his staff, as the department moves forward in improving outcomes for children. So without further ado, to present on the community umbrella agencies and improving outcomes for children, please join me in welcoming Mr. Gary Williams.
First and foremost, I want to give our regards, or the Commissioner's regards, to you. The Commissioner for the Philadelphia Department of Human Services, Vanessa Garrett Harley, was not able to be present today. I believe she was here on the last convening. Unfortunately, she was not able to be here today, and she certainly sends her regards. Thank all of you for coming out on this morning. I want a special notation and special thank you to Senator Williams and his staff, as well as Turning Points, and all of the coordinators of this event, the Kinship Care Committee, that collaboration of stakeholders. Thank you. This is a very important moment. This is very important work. And it's certainly my honor and privilege to be here with you on this morning. So if you don't remember anything that I say, please understand that the Department of Human Services, we certainly appreciate you, because who I'm speaking to, I believe that you are the heart of child welfare here in the city of Philadelphia. Kinship care givers, other stakeholders, other folks who are concerned and passionate about our children here in the city. So thank you. I don't take it lightly. I don't take this moment lightly to speak before you. Thank you for your time and your consideration. First, before I get to the PowerPoint, I wanted to just kind of give you a few words on, from a historical context, the name Kinship Care. Some of you may be aware of this, but in 1990, the Child Welfare League of America did a national convening. This was in 1990. This was in partnership with the National Foster Parent Association. And the purpose of that particular convening was to highlight foster care as a viable option for dependent children. The charge was, how can we improve upon this particular system and highlight it in such a way that we would get more folks involved. In that convening, the question was raised, what about the relatives who are a part of this foster care system? What about those folks who step up and care for their relatives? Because the interesting thing is, there is a different dynamic when we consider resource parents or foster parents and also our kinship care parents. It's a different dynamic. And one of the things that we see at the department is that when a child is being cared for by family, sometimes the system and sometimes the parent relaxes that sense of urgency in moving towards family reunification and moving towards permanency. Truth be told, sometimes that we see that. So there is a different dynamic. So legislation doesn't relax their expectation. And what I mean by that is, if a child remains in care for a period of time, specifically 15 consecutive months in care, out of a 22-month spread of time, DHS, we have to go to the court and change the goal to adoption. That's not a long time. That is, in the life of a child, 15 months is a very long time. But when we talk about dealing with some of the social issues in our communities, it's not a long time to get things resolved, if you will. So there's almost a relaxing of sense of urgency when a child, and I'm talking specifically about that child who is in the system. We know that there's an array of families. There's a multitude of families and children that never hit the system, and then because there's some informal arrangements with that child and living with relatives. But I'm speaking about those children who actually come into the system. So my point to that is there's a unique difference. There's a different dynamic in that particular situation. So the question came up at this convening, what do we do? Is there a distinction? Should it be a distinction? So they came with a number of names trying to define what this situation is when a relative actually cares for a child who needs that level of care. And they had a number of iterations of names, if you will. And this, again, early 1990s. Some of the names that were considered were relative foster care, or relative home, or de facto foster care. None of those, and there was a list of them, none of those names seemed to really capture the strength of families, and none of them were really family or child-centered and user-friendly, if you will. So one of the directors of the Child Welfare League of America at the point in time referenced a book that was written in 1974. This book was called All Our Kin. And the book was actually written by a woman, Carol B. Stack. So it was published in 1974. The interesting thing about this piece of work, the author was an anthropologist who actually did a study in one of our major cities in the Midwest. And the focus was on an African-American community. And truth be told, the backdrop of the story is around that, in that time, and even in some circles today, there was this notion and thinking about what was called the poverty or culture poverty, or the culture of poverty. And underneath it really is really blaming the victim, or blaming that group who were under-resourced, if you will. So under that particular notion, it was about, the thought was, if you raise the income of those individuals, they would still end up in poverty because there was something in terms of inherently wrong with the culture. So she does this study, and what she did was she lives in this particular community for 2 to 3 years, and really she was in a position to produce publication that really supports what we know all along. Out of that research, what she came up with was she highlighted the network of kinship care. And the understanding that in these pockets, in these communities, there was great family resilience. There was a network, whether you were related to that child or not, there was a kinship network of support that supported those children. And what it looks like on the ground is basically the big mama taking the child when mom couldn't take her, or when dad wasn't in a position to take the child. What it looks like in the community is that next door neighbor, or the neighbor across the street that we call Aunt Susie. And Aunt Susie has no biological relationship to this particular family, but that's part of the village, if you will. That's part of the support network. So in spite of these trying social ills that this community was ripped with, high unemployment, poverty, a system that basically keeps folks in poverty, despite all of that, you saw family strength, family resilience, a sense of community. So the term kind of was elevated in this piece of work, Kinship Care Network. So they borrowed that terminology and say, listen, this is what we call this, kinship care. So when 1997, it was actually the first national convening of kinship care, and it took place in San Francisco. So 1997, it's crystallized, if you will, kinship care as a part of child welfare. We understand that kinship care goes back longer than that, decades, centuries, right? We understand that. But in terms of child welfare, the name actually came to the surface because of that work that Carol Stack, part of the work that she actually did, and the understanding how the family and that family system network, whether there was a biological kin or not, that was a security blanket. That was what Mr. Fair had referenced. The solution to a lot of our problems rests in your strength. So this is why this day is so important. So a little historical context. So the rest is history. Now we have this convening on kinship care. You have DHS coming out to talk. But that's some of the historical context and the historical legacy that we are a part of. DHS. Currently, we have over 5,700 children in dependent care right now. We know that children do better, not in congregate care or institutions, but they do better with their families or family settings. So we understand that. I'm happy to say, out of the total number of children in dependent placement, we have 40% of those children who are actually in kinship care. Now, we understand outside of the system, there's a whole network of families and children that never enter the system because of family kinship, because of that security blanket. Had we not have that, if we did not have that, could you imagine how many children will be going into that system? So as a system, we understand children do much better in families. They're more likely to remain in the same schools. That placement experience is more likely to be shorter. They're more likely to be placed with their siblings. So these are all of the things that are that we understand about families who step up and take care of children. And just a little other piece of information before we go to the slides. The department has moved and made a significant progress in getting children out of congregate care. When I say that, I'm talking about your group homes and your institution. Over the last 3 to 4 years, we've done a remarkable job with actually having children come back out of those placements and in either with their family or at least a family setting versus a institution or a group home. Today, we actually have about 14 or 15% of our placements that are actually children are in family or kinship care or family-like settings. That is from 24, 25%, maybe just 2 to 3 years ago. So we've done a lot in the way of trying to actually have children back home or back with family. It's pretty significant. So I don't have a whole lot of time, so I will go to the slides because I do want to leave some time for us to have some dialogue. So what I want to talk to you about is this system transformation that we call improving outcomes for children. Improving outcomes for children. Everything that we do has to line up to the mission and vision of DHS. So when we talk about the mission, we're talking about child safety, permanency, and child well-being. IOC, what is it? IOC is a community neighborhood approach to doing child welfare here in the city of Philadelphia. It's really a decentralization of service, a decentralization of expertise in the communities versus having folks come down to a building in Center City, 1515 Arch. It's really decentralizing the service and making the service and the level of support more accessible to families in their own communities. Why do we do IOC? These are the outcomes. These outcomes are what we want you guys to hold us to. So more children and youth maintain safely in their homes. If placement becomes the last resort, and if it becomes possible, we want that child back home as quickly as possible. That means we need to surround that family with the necessary supports to make that happen. Reduction of congregate care, I just mentioned that. We've made a lot of progress in that particular area, but it's so much more that we need, and so much more that we can do, but we can't do it without you. Improving the overall family function. So these are the outcomes, the desired outcomes that the department has as it relates to improving outcomes for children. Core principles or values. Core principles or values. Why do we do? Or what's important in this work? Community. Community is essential. We understand that the child maltreatment and the things that our children are faced today is not a DHS problem. It's not a Turning Points problem. It's not just one entity or it's a community issue, and that requires a community response. We can't do this without you. Community is important. One family, one case manager, one plan. We'll talk a little more about that. Voice of the child and family is critical. Voice of the child and family is critical, and also all roads lead home. So whether that child goes into kinship care, whether that child goes into a group home, all of those tracks should lead that child back home with the necessary supports, if at all possible. So up at the very top, you see the value of community, or the principle of community. The question is, how do we do this community-based approach? How do we actually make these services and supports more accessible? One of the ways that we do that is through what we call community umbrella agencies. The community umbrella agency will evolve into being the hub of information, resource, support, information in that particular community where that family lives, opposed to a centralized location downtown in Center City. Theoretically, that is the entity for that community. We have 10 community umbrellas across the city of Philadelphia. The geographical areas were actually divided based on police district. So if you know your police district, you should know your community umbrella agency. So that particular geographical area, we're expecting the community umbrella agency to have a strong presence, to be the experts on the needs of that particular community. But again, that can't happen without your support, without you. The idea was for these community umbrellas to have not just your mandated services, but also prevention services and support. The one thing that the DHS had to maintain was our responsibility to do investigations. So we maintain the responsibility of having our hotline. We maintain the responsibility of doing investigations on families that come to our attention. But what the community umbrella agency actually is responsible for, what the department has delegated and shared that the responsibility for, is the ongoing case management, working with that family. So that takes us back to the one case, one plan, one family, one case manager. So your CUA case manager is ultimately responsible for the coordination of services with families that enter our system, and not DHS. The other thing about this community approach, the community umbrellas are also charged with having the family planning meetings, what we call single case plan meetings, in the context of that community. So rather than coming to 1515 R Street, which is our location, DHS's location, the expectation is that a family who is actually working with a core case manager should actually be able to go to that office in their community, or the neighborhood church who has a partnership with the community umbrella agency, or the rec center, which is around the corner possibly from that family. But those meetings that are very important, really, the design is really for those things to take place in the context of the community. Here's a map of the CUAs across the city. So we have 10 total, and there are 3 community umbrella agencies that actually have responsibility for 2 areas. So it's 7 CUAs. 3 of them have actually responsibility for 2 separate geographic areas. We'll leave some of this information with you today, and actually after the presentation you certainly can feel free to come and talk to me. I have my information if you want more information as you learn more about the process and the programs. Just wanted to give you an idea. Single case management or single case plan, again, what I want you to remember is 1, 1, and 1. I'm going to talk a little bit more about this. 1 single case plan, 1 case manager, and 1 family. Why this is so important: prior to IOC, a family who entered our system could possibly have 2, 3, or 4 different professionals working along with that family. Those professionals that were charged with helping that family could have their own individual plans. Some of them sometimes made sense to the families. Other times there was a disconnect in multiple plans. This idea about 1 plan is that in 1 case manager, that core case manager is ultimately responsible for all of the coordination of services for that family. So if there's an issue around behavioral health, that's in that single plan. If there's an issue around parenting skill building, that's in that single plan. There's no longer the foster care agency who has their separate plan that's separate from the DHS plan. 1 single plan. We owe that to the families. We owe that to the children. We owe that to the parents. They need to understand what's the focus point, and they also need to be a part of the process of building that plan. So in a minute, I'll talk to you about what we call the family team conference. But I want you to remember, as we move forward in IOC, this is a very important principle and value. 1 plan, 1 family, 1 case manager. So this is why the DHS ongoing service social worker has stepped out of the picture. We've delegated the responsibility to the core case manager, and DHS takes on a monitoring and quality improvement kind of assessment work with all 10 CUAs. So we're not completely out. Ultimately, we are still responsible for those children, but we've partnered with our community umbrella agencies to provide the ongoing service delivery. Talk about the team conferencing. And Carly, just give me a signal if I go too long. In this model, we have what we call family team conferences. So the question that might come to mind: all of the DHS social workers who are actually doing ongoing service work with families, what happens to them? DHS, if we're giving the responsibility for ongoing case management to our community umbrella partners, what happens to the social workers who are at DHS? What we're doing is actually expanding the capacity on our front end, meaning our hotline and investigations. We want to be in a position where the hotline investigator, the intake investigator, has a workload sufficient enough and within reason whereby a quality investigation and engagement of family is possible. So we want to have more of those investigating teams on our front end. The other place that they're going is we've created new responsibilities to support this model. So we have what we call a team coordinator, who is a social worker who's responsible for helping facilitate the family conference. That person is responsible for engaging the family, most importantly, and also the family support network, right? The aunt, the uncle, the godmother, or whomever that family identifies as a support. And also the other stakeholders, your attorneys and et cetera. So that person is responsible for that. Then there's what we call a practice specialist, who's a supervisor, master level supervisor, and that person is responsible to facilitate the conference itself. So what that looks like is that person facilitating the conference with the family, with the community umbrella agency, and all of the other support people and professionals in that conference. And the goal is to develop that single case plan that I talked about. So when we talk about having the voice of the family, if the child is 14 and over, it's a requirement that that child be a part of the process. It's intentional outreach to the family and the family support by way of the team coordinator to get folks to the table. It's very important that they be a part of this process because it's about their lives. And the whole idea is to join with the family in developing what makes sense and what's going to keep this family together, what's going to keep the children safe. And so there's 4 types of conferences. So when an investigation happens, when we do an investigation and we've identified a safety threat, and we're saying, well, this family will need to enter the system based on what's happening, we have what we call a child safety conference. That's the very first conference. So in that particular conference, we're looking at the safety assessment, we're looking at the safety plan, and we're beginning to make the orientation and introduction between CUA, and I say we, meaning DHS, between our CUA umbrella agency partners as well as the family. That's the very first meeting. 20 days from that, we have what we call a family support conference. Now, this is a conference where the child has not been removed from the home. There's some concerns that we want to work with the family on and build the stronger network, and the child remains home. That's the family support conference, happens 20 days from the safety conference. And the takeaway from that is to develop that single case plan. No longer will the foster agency have a plan and this one has a plan. If there is a behavioral health need, that therapist should be invited to that conference. So anything related to behavioral health, anything related to special needs of the children, those folks are actually engaged in that process if it's working well, the way it should work. If by chance we've had to remove the child from that home, then we have what we call a permanency conference. So we're just changing the focus at that point. It still happens 20 days from the safety, but it's called permanency. And the focus is on how can we get this child back home if at all possible. And if not, what is the concurrent plan for the child? Because we understand that it's unfair to a child to be left in a situation where there's no sense of permanency. And then we have placement stability conferences. That basically is triggered if a child is in care and has to move to another home or another placement location. It can't happen. Or if it's an emergency, this placement stability conference has to happen within a period of time. Why? We don't want disruptions in placements, and we don't want children bouncing from home to home to home. Because we understand that even if that child remains in kinship care or that resource parent that is willing to adopt, we understand what happens, what's important for child development is lifelong connections. Many of our young people historically have aged out of the system, so there's no real connection with their biological family. And then there's some foster parents that maybe were in it for the wrong reasons, and there's no connection with the foster parent or the resource parent. and the child ages out disconnected from their community. So this is why this stability conference is so important. And this is why the work that you do is so important. I know I'm going to have to move on. Partnerships, resource parents, including kinship caregivers. And this is simple. What we're looking for from DHS's perspective, we're looking for resource parents and kinship caregivers that's going to have children in their homes, that's going to love them, be committed to them, and basically treat them like you're going to treat your very own. I had the privilege to hear a panel of young people who aged out of the system. So we're talking about 18, 19, 20 years old, and it was maybe 7 of them. After hearing their stories, and you can imagine, after hearing their stories, it became very clear the themes that they highlighted in their testimonies, if you will, in their experiences with the system. And the theme that was highlighted was, I just want a sense of quote unquote normalcy. I don't want to feel different. I've been in foster homes and the foster parent treated me. You knew it was a clear distinction between their children and the foster child. Or I've been in kinship care situations and kind of been felt the same way. You understand? So the theme was, I want to be accepted. So we're looking for parents who are patient. We're looking for parents who will commit to that child and do for that child. When it's time to go to the doctor appointment, the child has to go to the doctor. When there's something happening in school, what you do for your children? You go to the school. And I know I'm preaching to the choir, but I'm just unpacking some of those things that the children deal with on a daily basis when they don't land in a home that's appropriate. So and I'm getting ready to finish up. But the point is this. The theme was, I just want to be given unconditional love just like everybody else. And it's important to their development. So we can spend all day on that one. It's kind of the same thing. Carly has just given me my notice, and I do want to get a question or two. This is just a illustration of what's happening, what happened before IOC versus what's happening now. And in summation, it's really about doing child welfare in the context of community and building partners, and then really embracing the proverb, it takes a village to raise a child. We look at you as partners, not us against you. And there's no such thing as a perfect system. So DHS will never proclaim, oh, we got everything right. I know you'll be probably the first one to attest to that. But together we can make it better. Together we can make it better. So that's really what this whole IOC is really about. It's the acknowledgement that community is the answer. So I want to just leave this up here. Kimberly Ali is our Chief Implementation Officer. She is the point person for improving outcomes for children and the work that we're doing. I'll also, I do have business cards if you need my information to contact me further. And I'll stop there because I do want to, do we have time for questions? Okay, thank you. Do we have a hand up? Hand right here. I appreciate your question. So let me, yep. I will preference this with, if there are particular situations that you're struggling with that are unique to your family, I will hang around a little bit so you can get my information. I don't want to necessarily, we can't deal with all of those here, but I will hang around a bit if you do have some issues that was raised. 2 things I want to mention, and I'm real quick. There is a prevention arm that the department still has, and when we say prevention, we're talking about working with families outside of the formal, without being formally accepted for services under CYD, what we call Children and Youth Division. So when you call, just bear with me, when you call DHS and there's no element of abuse or neglect, your situation is different. I'm going to point out the difference. But for a family who really needs some help, a biological parent who needs some help, if there's some acknowledgement that there's some help that you need, that's a strength. So that might not mean we need to get involved as a child protective service entity, if you will. That might mean you might just need some support, whether it's case management or could be some level of financial or resource assistance. We do have what we call family empowerment services. That is an in-home case management service that families who find themselves struggling and there's not a child abuse and neglect issue, we're just talking about possibly maybe under-resourced or you fell on a situation where you need some help. It's family empowerment service, which is, again, funded by DHS, that we can offer you. Also, there's a network of truancy providers. So a child is experiencing some issues around truancy. If that is the only issue, we want to keep them out of the system if at all possible. We have 10 truancy providers that basically connect with their corresponding CUA in that particular geographic area. Again, that is a level of case management and support that a family can get without being accepted for services. When you call 683-6100, there's a prompt. One of the prompts that would be helpful is information and referral. So that will get you a person, a social worker, that can connect you to certain resources without formally entering the system. Your situation is a little different. These were not your biological children, right? So when you get that kind of response, you want to push that up the chain of command, because technically if the parents are out of, not accessible, and they're not doing what they need to do by their children, technically you have dependent children, and you may need help as aunt, grandma, or whomever. So that's a little different. So in those kind of situations, you bump those up. I think the response was not the best response, but there is still an obligation that the department has to do to assess really what's going on. But again, 215-683-6100. Information and referral can give you general information about that, and I hang around to take another, to give you information. Probably only have time. 215-683-6100. That is our hotline number, but if you listen to all of the prompts, it will give you customer service if you're trying to find out the name, or not the name, but the number or contact information for a social worker, or you need some help. It's not abuse or neglect. You need some help. Information and referral is the prompt that you want to select. Okay. Yep. Thank you so much, guys. I will hang around. I do have cards. I'll give you my cards. I want to be a good steward of the time, but I don't have. I've been told I can't take another question. Thank you.
So we'd really like to give a hand to Gary Williams. We also, when the resource tables come up, there are representatives from DHS that are here with resources and information, and your CUAs are here with resources and information. So for some more specific questions, please stick around until the 12 noonish area time frame when the tables go up, and you'll have a chance to talk to DHS, the CUAs, and Mr. Williams will be with us for a little bit as well. Okay?